Good afternoon. It's a pleasure to see all these alert faces late in the day. Thank you for being here. I am Shaman Banerjee. I am the co-site lead of CDL-Wisconsin. And those of you who do not know where this site is located, it is in the beautiful city of Madison, about 130 miles northwest of Chicago. So at least in North America, if you hear Wisconsin, I think you think of two things. The first is football. And I know some of you will be offended because it's not the kind of football many of you think. It's American football and the Green Bay Packers. And the second is cheese. Thank you. And it is not surprising that the two streams that we run in CDL-Wisconsin are the two that they are. So the first one is risk, which is not just insurance, but much more than that. And if you think of 70,000 people sitting in the middle of January, early February, in an open stadium, cheering for a football team, do you see a better risk than that, higher risk than that? So first stream is risk. Our second stream is health and wellness. And if you go to the beautiful terrace of our university and eat a box of fried cheese curds, the next thing you need to think about is your health and your wellness. So these are our two streams. And we are very happy at the way these streams have been evolving. This year, the risk stream has graduated 10 ventures. Health and wellness graduated 8. And we are very well supported by our partner, American Family Insurance. And we are very, very excited about where this CDL site is going. What is unique about CDL-Wisconsin, I think, is that we are a partnership between the School of Computing, Data, and Information Sciences and the School of Business. In fact, the School of Data, Information, Computing Sciences is moving to become a new college of computing and AI. And our campus just recently hired an associate vice chancellor for entrepreneurship. So a lot of exciting things are happening in the area of entrepreneurship there. So with that, today to represent CDL-Wisconsin and the health and wellness stream, I'm going to invite the company Sharpen and their CEO, Robin Hussa-Farrell. And instead of me telling you about what they do, I'll let her speak to the company. So please, welcome, Robin.
It works. Hi, my name is Robin Hussa-Farrell. I am indeed the president and CEO of Resiliency Technologies. We have a system called Sharpen. I'm going to start with a little story. This is obviously representing a metaphor of one of our clients currently that have over 2,000 patients on a wait list to receive mental health care. These happen to be pediatric patients. At another one of the clinics where we are working, we have those patients on a wait list for up to 9 months. Just think about that. It's not that the system is broken. It's that the system didn't really ever exist. And so it requires a paradigm shift of a massive scale. And so what we've created is Sharpen DTX. This is a clinical decision support and triage system that interacts directly with electronic health records to immediately convert that wait list into reimbursable care pathways. So what we are able to do is evidenced by this quote. This is a client that is about to onboard our system for the patients they're serving. They sent us an email yesterday as the introduction to the physicians to be introduced to our system. We wanted to remove as much friction as possible, so we brought our solution directly into electronic health records. This is where clinicians may open up the patient record, click on that red circle, and immediately triage and prescribe interventions and the best practice protocols in the case of mental health treatment. What we are able to see with this is it is much more seamless, makes a frictionless process for all the clinicians within the primary care and specialty care realm. We are live at Prisma Health Children's Hospital serving patients where the project has gone so well, they've expanded to other levels of care. We're seeing patients in the system beyond 13x the traditional benchmarks in digital health, 44 minutes. And why are we seeing those benchmarks? We took time to listen to the patients. We actually curated our interventions featuring the stories of the patients themselves. Upwards of 44 minutes in the modules, we've seen, of course, increased clinical outcomes, not only decreased stigma, but improved readiness and compliance with care. And this is a great example of how the system should work. Last July, we integrated at a Division I university where we treated 408 Division I athletes in one day. Engaged with one of our mentor, Yehuda Cohen's product called the CATMH, a gold standard mental health screening tool. Those patients were able to go through screening, triage, care coordination, and a 2-month intervention all in one moment. At the end of this, we found 8 students who were immediately at risk. That red button, clinicians just clicked on it. They were immediately able to triage them. This is an actual dashboard of one of those patients. The circled area is where they showed at risk. The bottom area is where they went through 2 months of the intervention. The top area is where they showed the post-test, no more risk. Seamless integration, curated experience for each level of care. This is a great quote from another one of our mentors, Dr. McNulty, who has been a physician executive for decades. It's sharpen or the void. And it's not because we don't have other competitors in the space. We certainly do. There are competitors in the AI space that we are actually partnering with because our AI system is in symbiosis with theirs. We developed our AI based on 20 years of epidemiological data in the public health realm and those patient stories that are so rich. We are engaged currently at Stanford Children's, at Prisma Health Children's, and working in clinical partnership with them, along with UCSF and University of Wisconsin, to pressure test our AI algorithm. We are also funded through agencies like SAMHSA and state agencies like the New York Office of Mental Health. We anticipate in 2 months a SBIR grant that will be non-dilutive funding, anticipated within the next 2 months. So by the numbers, we have benefited from the most amazing 15 mentors at CDL. They have introduced us to 23 potential clients and partners, and we've seen an 80% increase in our ARR. We hope you would join us in Powering Healthy Minds by either introducing us to additional clients or partners, research collaborators, and we are raising $3 million in seed based on some of the milestones that I've mentioned today. If you're interested, please find me or find us at sharpenhealth.com. Thanks.